Thank you for joining me on the Save My Thyroid podcast, where I help people save their thyroid and regain their health. My name is Dr. Eric Osansky, and if you have hyperthyroidism, including Graves' disease or toxic multinodular goiter, then you will especially benefit from these episodes. If you have Hashimoto's thyroiditis, you also need to save your thyroid, and therefore you will also find many of the episodes to be valuable. You're about to listen to another Save My Thyroid health audit, as I will spend approximately 25 minutes chatting with someone who has a thyroid or autoimmune thyroid condition and give them actual advice to help them improve their health. In this Save My Thyroid audit, you will witness me being a bit stumped, as without question, this wasn't a typical thyroid case study. The name of the person I chatted with is Dee, and she was dealing with hypothyroidism for many years, and she was taking levothyroxine, but then it appeared that she switched to hyperthyroid based on her lower TSH, a mildly elevated heart rate, and tremors. However, her Graves' disease antibodies were negative, and her most recent thyroid numbers look pretty good, even though she is still experiencing symptoms such as tremors as well as eye soreness. Now, just a reminder that this audit isn't exactly the same as a comprehensive consultation I do with a patient, as prior to doing an audit, I have the person fill out a brief application, and if it's fine, and it's fine if they send a few basic blood tests, whereas with a patient consultation, I'll have them fill out a comprehensive health history and other forms, and it will usually send a decent amount of labs for me to review. And of course, a patient consultation is a lot longer, but either way, I'm confident that you will find this conversation to be valuable. Also, if you would like to apply to do an audit with me, you could do so by visiting savemythyroid.com/audit. As usual, make sure you listen to the post episode chat after the outro music, as I'll expand on false negative antibodies, false negative thyroid antibodies, a high resting heart rate, tremors, subacute thyroiditis, as well as doing more detective work. And you can access the show notes by visiting savemythyroid.com/191. Here's my conversation with Dee.
Welcome to the Save My Thyroid podcast, hosted by Dr. Eric Osansky. To stay up to date on the latest thyroid health-related topics, make sure to subscribe on your podcast player. And to get your free thyroid and immune health restoration action points checklist, visit SaveMyThyroidChecklist.com. The following discussion is for educational purposes only and is not intended to diagnose or treat any disease. Please do not apply any of this information without first speaking with your doctor. Now let's head to the show.
So welcome to another Save My Thyroid health audit. I'm excited here to chat with Dee, and she has a pretty interesting journey. She has been dealing with hypothyroidism since, I believe, 2014. And then more recently, in spring of 2024, started to experience some hyper symptoms. So thank you so much for joining us, Dee.
Hello. Thank you.
Yeah, thanks for joining us. And so before we start, can you remind me how you found out about me, where you learned about me?
Yeah, it was on just Google searches. And then I found your podcast out there and have bought two of your books, the Hyperthyroidism or the Graves and Hyperthyroidism one. And then I just recently bought your Hyperthyroid Healing Diet book. So I've just been following you, reading, trying to listen when I can, just to learn more about what possibly can be going on with me.
And then, so you were diagnosed with hypothyroidism in 2014, and you've been taking levothyroxine for quite a while, so thyroid hormone replacement for about 10 years. And then what happened in spring of 2024, about 5 months ago, maybe April 2024, so about 5 months ago from the time of recording this, you started experiencing some hyper symptoms?
Yeah, we actually came back from a cruise, and I have like hay fever allergies and stuff like that. We came back from the cruise, and it seemed like we both, me and my husband, got really hit with like some allergies. I don't know if it's being on the water and then coming back and being in the middle of springtime here in Illinois. But anyway, I started with my eyes really being dry and sore and bagging. And I think that's how I started looking up. I actually saw my daughter, and she was like, "Oh my God, what happened to you?" And I was like, "I don't know." So when I looked it up online with allergies and stuff like that, and with the bagging, eventually, because the bagging was so bad and I kept just pulling that string on the Google, it eventually brought me to Graves. I was like, okay, well, I don't know what's going on with that. And then I really tried to put that out of my mind. And then it was probably a couple weeks later that I started experiencing heart palpitations and feeling like my left arm was sort of like buzzing almost. It just felt weird. I didn't even know how to explain it. Trying to explain those symptoms to my doctor and my husband, they're like, oh, okay. Finally, after the heart palpitations for a couple weeks went on, I finally one night told my husband I thought we needed to go to the emergency room because I really thought I was having a heart attack. I really honestly had not looked up the stuff at that time because I really was like, well, I'm hypothyroid and I've been hypothyroid the whole time. But I did learn on one test prior to that, I was doing a little bit of some weight loss drugs. The nurse practitioner that I was going to ran a blood panel. She asked me if I had ever been told I had Hashimoto's, and I had never even heard of Hashimoto's. To that, my doctor, throughout the whole time on hypo medicine, when looking back on my records, he had only ran TSH and stuff like that. I don't know if that's common, but that's what he had done. So I had never heard of that. It seems like it goes all over the place because that's what it has been since April. It has been, I've continued to take my medicine, even though I had hyper symptoms because my doctor still wanted me to. And then finally in July, he had me bump it down to like half a pill. Then finally in July, after putting up with more hyper symptoms than hypo symptoms, I finally just decided to take myself off the pill, the Levothyroxine, because I felt like I was doing it to myself at that point, given causing the hyper symptoms. I was hoping that would resolve it because he really did think it was overmedication problem at that point. But I'm still having this stuff. So I don't know if I'm hyperthyroid now or hypothyroid, or if this is just Hashimoto's. I really don't know which way to go on it anymore.
So you stopped in July. Again, we're recording this in late September. So it's been a couple of months. And you said you still are experiencing some of the hyper symptoms like the palpitations and tremors?
Not so much the palpitations, the tremors. And I don't know if this is to do with this, but trouble sleeping, trouble going to sleep. I'm 55 years old, so menopausal. So waking up every once in a while wasn't uncommon or anything else. But now it's like trouble going to sleep. It's like 10 o'clock at night and I'm still like sitting in bed, like, why ain't I sleeping yet? I don't know if that has something to do with it, but I thought it did with being hyperthyroid. I do try and keep track. I bought a Fitbit, or not a Fitbit, this is an Apple Watch. And I tried to keep track of that with my heart rate. And like right now, it's 78, which my normal resting on the Fitbit, this now is normally about 68 when I'm sleeping. I don't think 78 while being up and being a little nervous on the podcast is probably too high.
Yeah. So 68, like when sleeping, 78, this is like on the higher end. Like you haven't noticed it like in the 80s or 90s as far as resting, just like throughout the day, just not moving around, but just sitting like you are now.
Sometimes it goes up, but most of the time it stays down.
All right.
But resting normally is 68, like sleeping. But there's been times when it did get, like that's why I ended up at the emergency room. It was like 116 just sitting on the couch.
Okay.
And that time they did pull a TSH when I was at the emergency room. And that's when I had a low TSH, which I started really thinking, I was like, oh, wow, this may be hyperthyroidism.
And how low did the TSH go?
It went to 0.67.
0.67. And you said heart rate was at one time 116 beats per minute resting?
Yes.
So definitely nowhere. The resting heart rate has been a lot better since then. And again, you've been off of the thyroid hormone replacement since then for a couple of months. So you mentioned Hashimoto's. Now I know you had the Graves antibodies, the TSI, which was negative, was less than 89, which is negative. Did they test the Hashimoto's antibodies, which are either TPO antibodies, which are also actually common in Graves, but more closely associated with Hashimoto's, TPO or thyroid peroxidase antibodies or thyroglobulin antibodies?
Yeah, they did. When I started, the nurse practitioner for the weight loss drugs first did it when she ran my blood, and it was like 94 is what she had. And since then, I have ran it a couple times, and my TPOs on like in July were 17. And that was on a scale of like negative 34, I think, as they said was. Okay. And then I recently had it done just last week with that TSI through that lab, and it was 12, and it was on a scale of 9. So I guess there's 2 scales that they run that stuff on, depending on what lab you're going to.
Different labs have different ranges. And you said it was as high as 94 at one point?
Yes. That blood test would have been about January, February, before I started experiencing any symptoms.
You didn't have the other antibodies I just mentioned. You don't notice those, the thyroglobulin antibodies in your report?
I had one that said, and that was back in July, and it said less than 1.
Okay. Yeah. So negative. I will say this about Graves. So usually the TSI is positive. It's not perfect. Antibody tests aren't perfect. It's possible you could have false negative antibodies. I will also say, though, usually with Graves, the TSH is undetectable. Like 0.67 is definitely less than optimal. But usually, like people with Graves will have like less than 0.001 or 0.005. It depends on the lab, but it will be undetectable. Now, the eye symptoms are interesting just because with Graves, you're right. It's very common to have thyroid eye disease symptoms. So are those actually thyroid eye disease symptoms? That's definitely a possibility. And small percentage of Hashimoto's actually develop the thyroid eye disease. Most of the time it's Graves, but so again, it's a little unusual. Usually the TSI is actually very high in those with thyroid eye disease, and yours was undetectable. You've been off the thyroid hormone replacement for 2 months. Have you had a thyroid panel since being off of the thyroid hormone replacement?
Yeah, that's thyroid panel. I had one done with the TSI one. So it gave me like my TSH, my T3, my T4, all those figures.
Yeah.
And I just had that done last week, the week before, September.
Did you say the TSH, we were chatting a little bit before pressing record, was it over 2 or?
Yes, it was 2.05.
Definitely not hyper. I mean, it is
Strange.
interesting. I would say an optimal TSH between 1 and 2, maybe even between 1 and 1.5. So maybe again, that's not hypo. Like most doctors won't consider a TSH of 2.05 to be hypo. And some functional medicine practitioners would consider it maybe a little bit higher than optimal, more hypo than hyper. Let's put it this way.
Right.
It's not. So I don't think it's Graves, because with Graves, the hyperthyroidism would persist even after stopping the levothyroxine. And then again, usually we would see the TSI, again, not perfect, but your heart rate is also not, it's a little bit higher than optimal, but 78 is not too bad. I'm thinking it's not Graves. I mean, could be the medication, but I guess as far as Hashimoto's, so the thyroglobulin antibodies negative, which is good. TPO antibodies, that's interesting because 94, not crazy high. I've seen people in the hundreds, sometimes even in the thousands with the antibodies. And so 94, definitely well above the range though, like there's no question. Whereas then it was 17, which was within that lab's range. And then recently was 12, which is mildly high, even though it was a little bit elevated. So based on your current numbers, technically, if you went into without your past history, you just went to a doctor's office, they might not even diagnose you with Hashimoto's or hypothyroidism because, again, everything's kind of borderline. Like the TSH is well within their lab range, and then the antibodies are slightly high. So I don't know if they really would make a big deal out of it unless if you were having a lot of hypo symptoms. They wouldn't even talk about hyperthyroidism or Graves, even with the tremors, but they would be wondering, are you having any brain fog or fatigue or current weight gain or constipation, hypo symptoms? And if not, then again, they probably wouldn't do anything, honestly, on those current numbers. So the question is, where do you go from here? Because you've been off the thyroid hormone replacement for a couple of months. You're still experiencing the tremors, the palpitations aren't there, thankfully. And the heart rate is definitely not 116 like it was previously. It's not crazy high, so a little bit higher. Just before we talk about where do we go from here, as far as what can cause the hyperthyroidism that we already mentioned and you mentioned, and the doctor mentioned maybe too much thyroid hormone replacement. So possibility It's just odd that you are on it for 14 years. And then you figured if it was too much that you would just have to reduce the dose and not come off of it completely. And you're a bit off of it completely and your numbers are still looking good. There's also Toxicosis, where someone has Hashimoto's, the antibodies for Hashimoto's. And by damaging the thyroid gland, you get the release of thyroid hormone into the bloodstream. Toxicosis, sometimes that could cause transient hyperthyroidism. I'm not sure if that's what we're seeing, just because, again, you can't always go by how the antibodies are. But again, they are really mild and your hyper symptoms are, back then they were not mild, but who knows? Maybe it was a combination of the thyroid hormone. If someone has Toxicosis and if they're taking thyroid hormone, they're definitely going to feel really hyper. That's a possibility. There's also what's called subacute thyroiditis. Subacute thyroiditis is typically caused by a virus. Did you have COVID or anything?
I had COVID, I think, throughout the course of COVID. I think I had it one time and it was very mild. I think I've had like 3 shots. So I'd always gotten immunizations for it. So
nothing in 2024, like no viruses.
No, the only thing is, like I said, when we came back from that cruise, I was on antibiotics because the allergy's so bad. The doctor thought I had like a sinus infection, which was uncommon for me too, because I never get that kind of stuff. I just a fairly, I think, healthy person. Like I said, when I had COVID, I tested positive, but I really wasn't experiencing any symptoms. I think I'm just generally a pretty healthy person. So that sinus infection was out of the blue. And that all transpired when we got back from that. And when I had the problem with the eyes and the bagging and everything, it's like that. So I don't know if I had an infection that maybe, I can't remember what they give. They gave like prednisone.
Like a.
Yeah. So I think that kills a lot of stuff when you get it, so I don't know if I had an infection that we didn't address.
Possibly. I mean, subacute thyroiditis, usually viral. Sometimes it could be bacterial. And that usually is temporary hyperthyroidism. And then the person eventually would be hypo. Difficult to know for sure, but something, I don't think it was just the thyroid hormone replacement. I think something else caused the hyperthyroidism. And again, it might have been temporary. I don't think it was Graves. Maybe, like I said, Toxicosis, subacute thyroiditis. And then, so that if you're not taking thyroid hormone, again, those could cause hyperthyroidism. But then on top of that, you had taken the thyroid hormone and then you had that transient hyperthyroidism kind of made you really hyper and have those like extreme symptoms, including the resting heart rate that was very high. So that, again, subacute thyroiditis, usually temporary. Toxicosis many times is transient. So assuming if it was one of those, or again, another infection, but when I say subacute thyroiditis, I'm suggesting that an infection actually, whether it was bacterial or viral, affected the thyroid. Back to where we are now. So let's say it was that maybe the hyperthyroidism is behind you. I mean, as far as why you're still experiencing the tremors and you still are having like the eye soreness too. Hey, this is Dr. Eric. And if you're looking to do everything you can to save your thyroid, in addition to listening to this podcast, there are a few different ways we can help you. First of all, I've written 3 books on thyroid health, 2 related to hyperthyroidism and 1 related to Hashimoto's. And you can get all of them on Amazon, or to learn more about them, visit savemythyroid.com/thyroid books. Second, you can also join my Graves' disease and Hashimoto's healing community by visiting savemythyroid.com/thyroid group. And finally, if you want to get personal help from me, you can visit the website workwithdreric.com. Just to let you know, I only see a limited number of new patients each month, and I do require anyone interested to complete a brief online application before working with me. And now back to the show.
Some days more than others, but I did go to a TED specialist for that, and he measured my eyes. They said that there was pressure behind them, but he thought I was having dry eyes. And during this, my eyes they really have changed. And he was like, well, that's just age. And I was like, they've changed. Didn't look like this last week. I get the whole age thing, but during this transition or during this period, the one on my left, it bags more, it's swollen underneath, still to this day. this one has more bags. And I get that he can conclude that that would be just age, but this all occurred within those 3 months. So that's where I always have the thing. I did get a couple styes in the left eye during all this, and I had never had a stye before in my life. I don't wear contacts. I don't wear my glasses as prescribed. They're right here on my head. Once again, it was just all of it happened at the same time. And when I went to the TE doctor, he actually removed the styes because I think he said they were chalazons or something. And I actually had 3 of them in my eye, which to never have anything, I don't know, maybe my eye could still be bagging from all that trauma or something, but I'm still not convinced, about the eye stuff because it really did change drastically during that.
I would agree. I mean, I don't know if it's TED, and you went to a TED specialist, and I believe him if he doesn't think it was thyroid eye disease. But as far as just attributing it to getting older
Right.
and just out of the blue, especially when it developed right around the time everything else happened, I don't think
Exactly.
that's coincidence. Again, maybe not thyroid eye disease because you figured a TED specialist. He did say
Right.
there's some pressure behind the eyes, but again, there could be other things that cause that as well as the other symptoms. That's just a matter of what do you still have something underlying. So as far as what comes to mind, I can't say it's a typical case that I'm seeing. So, but I guess as far as doing further evaluation, further testing, it's never going to hurt to clean up your diet and lifestyle. I'm glad you said you got my 2 books. I think that was before I pressed record that you got my 2 recent books on hyperthyroidism, or my recent book on hyperthyroidism, and then the revised 3rd edition. I mean, it's never going to hurt to change diet and lifestyle and see if that helps. And you've already been doing that. And if you're following the recommendations, and if not helping, then further evaluation. So, I mean, if you go back to like a regular doctor, maybe they'll blow it off. Maybe they might refer you to a neurologist with some of the symptoms that you're experiencing. And it's not a bad idea to do that. Maybe they detect something. Then there's like the functional medicine testing, things like adrenal testing and gut testing, like comprehensive stool panel. Again, would you find something if you saw a functional medicine practitioner and you did those tests? Maybe. Even if you found something, does that mean it's related to what you experienced?
Right.
Maybe, maybe not. When we think of infections too, like I said, there's viruses, but then there's other infections that sometimes can cause weird symptoms, such as tick-borne infections like Lyme disease, Bartonella. And when I dealt with Lyme in 2018, there was no evidence of a tick bite. There was no rash. And so Lyme could affect pretty much all the bodily symptoms. It's called the great imitator, just because a lot of times, and I'm not saying you have Lyme, but maybe something to at least rule out and make sure you don't have that, or any other type of tick-borne, or it could even be like transmitted through fleas sometimes. But that could cause tremors, that could affect the eyes, that could also be a trigger for as far as affecting the thyroid or thyroid autoimmunity, which again, in your case, you had the autoimmunity, sounds like a long time ago. We don't know what the antibodies were years ago, unless you got those tested. So I don't know if they were a lot higher. So that might be something to look into. There's also things like mold, but it's like more of an infection, some type of infection. And sometimes infections are transient. Other times you'll take the antibiotics and it'll help, but it might not completely eliminate it from the body. Just something to keep in mind, because again, if you go to a neurologist, I'm not saying it's a bad idea to go to a neurologist. They'll do their sets of testing and see what they find. I mean, it could be another condition, another autoimmune condition. That's also a possibility too. And seeing a neurologist or rheumatologist might give information, but they're not going to address the cause of the problem. So if you go that route, like I said, it's not a bad idea. You would just be going to try to get a diagnosis. And then once you get the diagnosis, if they come up whatever diagnosis, what Lyme, for example, they would just give typically like antibiotics, or I mean, it really depends. But from a medical standpoint, they really won't do a whole lot. If it's another autoimmune condition, again, they're not going to do anything to address the cause of the problem. So that's why I'm saying it always will help to address diet and lifestyle. And then whether or not you want to consider either some functional medicine testing, or like I said, maybe looking into the tick-borne infections. I don't want to lead you down a rabbit hole, because again, it might not be that, but
Mhm.
obviously it's not normal to have the tremors and the eye.
Right.
I agree with you with the eye symptoms. Something
Mhm.
happened around that time. It just, as I mentioned earlier, not a typical case. And it's not most of the autoimmune markers are negative, and the only one that's positive is slightly positive. Just odd that now without thyroid hormone replacement, your numbers are kind of stable, like a little bit, like I said, on the
Mhm.
hypo side, but not terrible. So, I mean, obviously monitor that. I would continue to do an updated thyroid panel, maybe every 6 to 8 weeks, see how you feel too. Like if
Right.
you need to do one sooner than that, if you start feeling hypo symptoms, but just as important is just figuring out what's the underlying cause behind the tremors
Right.
and other symptoms you're having. And like I said, those are the two routes. The medical route's not a bad thing to try to get a diagnosis. Sometimes they're successful at that, sometimes they're not. And again, going to a functional medicine doctor, sometimes you could get that diagnosis as well. And again, the question is, do you need a diagnosis? Because, like I said, if you have a diagnosis, the conventional medical world won't do anything anyway. But still, sometimes it's nice to know that they have Graves and
Right.
Hashimoto's. It's nice to have the diagnosis. At least I know the
Mhm.
reasoning behind my symptoms. So, like I said, it's not a bad idea to look into that and maybe try to get a referral to another specialist. And at the same time, it's not like you still can't go the functional medicine route, do what you're
Right.
doing, diet and lifestyle. And you could do both. You could work with a functional medicine doctor while going the other route as well. That ultimately is up to you.
Yeah, I do have an endo appointment scheduled when all this stuff was going on. My PCM did actually write a referral for the TED specialist, and he did write one for an endo. But the area I live in, the first available was the 27th of November. So I figure with the results that I just got on my blood work, if it stays like that, he or she probably not going to be able to do anything, which
Yeah.
I should be glad because I'm on your Facebook page too, read all the things that they give you the metha.
Well, they're not going to give you the methimazole. I mean, that in a way, it's good that it's a couple of months from now because you're right. If you went right now, they would look at your numbers. I mean, assuming your numbers now were the same as just you got a test not too long ago. So if your TSH was still around 2, your
Hmm.
TPO antibodies were slightly elevated, and you're not experiencing hypo symptoms. And again, I guess they look at your thyroid numbers too, the T3, T4,
Hmm.
but I don't remember what those were if you told me those numbers, but my guess with
Yeah.
the TSH of 2, they're probably within the lab range, is my guess. Maybe they're
Yeah.
less than optimal, but I don't know.
Yeah. They're like free T is like 2. Oh, wait, no, free T4 index is 2. This was like a very comprehensive thing. T4 free was like 1.1,
Okay. So,
T3 with 3.1.
okay. Which is great. So free
Uh-huh.
T4 was 1.1, free T3 was 3.1,
Hmm.
which are really like optimal numbers. They're not hypo or hyper. I would pay more attention to those and the index, and they
Hmm.
might have done the uptake and all that too, the like T3 uptake. But TSH of 2.05, free T4 of 1.1, free T3 of 3.1. An endocrinologist will look at those numbers, even with the TPO slightly
Hmm.
high, and probably be like, let's just keep an eye on it. Right now we're not going to, yeah, definitely wouldn't give methimazole because you're not hyper. That's for
Right.
hyperthyroidism. If anything, they might lean more towards the thyroid hormone replacement based on your history of
Right.
hypothyroidism. But even that, I think honestly, the endocrinologist might be a little bit puzzled and be like, this is kind of odd. You've been off the
Right.
levothyroxine for 2 months and your numbers are actually not looking too bad and you're not experiencing hypo symptoms.
Hmm.
If anything, maybe a little bit more hyper with the tremors, and then the eyes aren't really sign of hyperthyroidism, some with Graves thyroid eye disease. But again, I don't think that's what we're dealing with. So I think your endocrinologist might be a little bit puzzled as well, just
Hmm.
not
I
really
am.
having an answer. So I think it's good to give it a little bit more time. And when you see the endocrinologist in November, it'll be 4 months off the thyroid hormone replacement. And if you start going hypo, then at that point, yeah, the endocrinologist, I'm sure, will recommend go back on the levothyroxine. And then at that point, you can make the decision. Do you want to just still do what we mentioned, like address the cause of the problem and not
Right.
just rely on the thyroid hormone? There definitely is a time and place for that. But then if it's looking good, then again, and then it's probably just going to be a wait and see approach. Be like, that's kind of odd that you are on thyroid hormone for 10 years and all of a sudden you became hyper, and now you're off the thyroid hormone for 4 months and it's still looking good. So that probably will be like the mindset if it's still looking good, but we won't know until
Right.
2 months. So definitely feel free to give me an update, and wish I could have been more helpful with this, but I think we need more answers. So I
Right.
don't think it's a matter of definitely not take methimazole based on what you said. Yeah, I agree. It seems like you would not need the thyroid hormone replacement, but let's see what the endocrinologist says in 2 months with updated thyroid numbers. But either way, I think you need to dig deeper, continue with the diet and lifestyle. Like I said, it might still come down to maybe going to a different specialist, because I don't know, like when it comes to the tremors, and if the endocrinologist really is the right person for that. But
Right.
to me, obviously, I'm going to be biased because I am a natural healthcare practitioner, functional medicine practitioner. I'm always going to say go that route to at least dig deeper, look into further testing. But
I'm hopeful that they'll go away because they came on sudden. I've never had tremors before, all this stuff. So I'm like, okay, maybe they'll go away. Do you think it's all right to still use your natural protocol when I do have the tremors, like the motherwort?
are you taking bugleweed and motherwort currently?
I take motherwort more than bugleweed
Okay.
because I don't know. It's called thyroid calming. It has like all three of them in there.
Oh, it has the from Herb
So
Farm.
sometimes I take that, like if I feel like at night, because the sleep thing has been it sometimes like bothers, it always is at night more than during the day. It's not even constant every day, but here the last couple of days it's happened again. So I did take the motherwort, just an attempt to do it. And I started acupuncture too after reading your stuff too. I had my first
Okay.
treatment last week on that. So I'm hoping maybe that would
Yeah.
help with the sleep. So
Yeah, the acupuncture I think is great. Who knows? Maybe that helps with the tremors too. So I think that's great.
mhm,
I wouldn't take bugleweed based on your thyroid numbers. It sounds like you don't need bugleweed because that's anti-thyroid. And
mhm,
again, your numbers are definitely not on the hyper side. Motherwort, I don't think there's a problem with motherwort. Motherwort is not really targeting the thyroid, but more the symptoms,
mhm.
cardiovascular symptoms. So even if someone doesn't have symptoms, they technically could take motherwort
Okay.
without a problem. So
Mhm.
unless if someone could have a negative reaction to any herb, but assuming they're tolerating the herb fine, I think motherwort's fine if you want to continue with that. But yeah, bugleweed I wouldn't take. Lemon balm, which the thyroid calming formula has too. Again, lemon balm, some will say has anti-thyroid properties. It's very mild if it does. I use it mainly for its calming effects, not
Mhm.
so much on the thyroid, but more if someone is having some sleep issues and anxiety. So I think even lemon balm or drinking lemon balm tea would be fine, and along with the motherwort if you wanted to. So yeah, I would say probably not to take the thyroid calming formula. With the thyroid, I would just say wait until the endocrinologist appointments, just see what the updated thyroid, because right now your numbers, your TSH, like I said, a little bit higher than I like to see, but your free T3, free T4 look really good. Not too
Mhm.
high, not too low, in my opinion. And so I'd say, let's see what in 2 months from now, I'm sure the endocrinologist will do another thyroid panel, and let's see what that shows. And then who knows? I mean, maybe at that point, yeah, some of your other symptoms might feel better, such as that maybe the tremors go away, the eye symptoms also improve. I mean, if that's the case, then maybe you don't need to look into anything further. But if those symptoms still persist, and if the thyroid numbers improve or not, whether or not the end result is you're back on thyroid hormone replacement or your numbers still look good, and the doctor endocrinologist says, okay, everything's good. If you're still experiencing other symptoms, then you're probably going to have to look elsewhere. That's where, unfortunately, not that you have to do the waiting game. Like I said, you could still see a functional medicine practitioner now while waiting, but
Mhm.
you might just even seeing the acupuncturist. I mean, it's not like you're not doing anything. Do you
Right.
need to spend a lot of money at this point seeing a functional medicine practitioner, spending a ton of money? I'm conservative with the test. It depends on the doctor you see. Still, do you need to go in that direction? Maybe not. Again, maybe
Mhm.
for now, just work on diet and lifestyle, get the
Right.
acupuncture, wait until the endocrinologist. It's ultimately up to you. It's not wrong to see a functional medicine doctor. I'm biased. I'm always going to say, yeah, it's not going to
Right.
hurt to see one. But if things resolve on its own, I guess my concern is those antibodies. Even though they're mildly high, ideally you want them negative. So maybe also in a few months, retest them again and make
Mhm.
sure if they're trending in the downward direction and looking good, again, then maybe you don't have to do things to improve your immune system health. But
Right.
even if your thyroid's looking good and you have the elevated TPO antibodies, I'm going to say that you want to try to figure out why. But again, the diet, the lifestyle, the acupuncture, those things are great. And those
Mhm.
alone might make a difference. So it's
Right.
definitely nothing wrong with just waiting a few months. So,
Okay.
appointment, okay?
That'll work.
All right. Well, thank you again for agreeing to do this, D. Again, I'm sorry I don't have like a specific answer, like this is exactly what you need to do. But like I said,
Mhm.
this is a little bit unique situation. Again, I appreciate you taking the time to have this conversation, and definitely feel free to give me an update after your endocrinologist appointment in
Okay.
November.
That sounds good, Dr. Eric. Thank you for your time.
All right, you're welcome. And thanks everyone for listening. Hope you found this to be valuable and look forward to catching everyone in a future Save My Thyroid audit. All right, take care, everyone. Take care, D.
Thank you for listening to the Save My Thyroid podcast. If you haven't done so already, make sure you hit subscribe to stay up to date on the latest thyroid health-related topics. And to get your free thyroid and immune health restoration action points checklist, visit SaveMyThyroidChecklist.com. Thanks so much for tuning in.
So that was a very interesting conversation. I wish every thyroid case was easy, but this definitely was a little bit of a challenge. She was taking levothyroxine for years, diagnosed with hypothyroidism, and then started becoming hyper and was told to continue taking levothyroxine. Then they thought it was overmedication, and she stopped taking levothyroxine, but still some of the symptoms persisted. No palpitations, but still having tremors, problems going to sleep. Her heart rate not crazy high, but like 70 beats per minute while on the podcast. First of all, I want to talk about false negative thyroid antibodies. I don't think that was the case with D. Again, she had TSI that was negative, thyroid globulin antibodies that was negative, and TPO antibodies that initially were in the 90s. Then they were negative according to the range, like 0 to 34, and then a different range, 0 to 9, and they were a little bit high at 12. But it is possible to have false negative antibodies, so we need to consider that at times. Again, with Graves, typically TSH is depressed, and her recent thyroid hormone levels look good. That she's not, if anything, again, more towards the hypo side, just because TSH a little bit above 2. But to me, this is not a Graves case. And getting back to the high resting heart rate, hers was mildly high, again, 78. And I asked her, does it get higher than that? And she says, typically it stays like it's not crazy high. And there could be other causes of increased resting heart rate other than the thyroid. So there could be infections, for example, could be a cause. Even problems with histamine could be a potential cause. Not saying that's a case with her, but I did mention Lyme disease as a possibility because of the tremors or tick-borne infections. And not that everybody who has tick-borne infections has tremors, but does not seem like it's related to the thyroid currently. Thyroid hormone levels are looking good again, and she's still having the tremors. Spoke about maybe seeing a neurologist, but I'm concerned about her again in the runaround. But there is a time and place to see one. Maybe this is, maybe this isn't. I know when I dealt with Lyme disease, I suspected it was Lyme disease, not right away. Initially, I wasn't sure. For like the first, when I started developing neurological symptoms, I thought maybe it was like MS, multiple sclerosis. Again, I wasn't sure what was going on, but then just speaking with other practitioners and putting the pieces together, I was then and thinking, well, maybe it is Lyme. And when I saw a primary care doctor to get a Lyme test, he wanted to refer me to a neurologist, which I was open to, but not right then. I wanted to rule out Lyme because I know there are a lot of people who go to a neurologist. And again, a lot of people need to go to a neurologist and they get the appropriate diagnosis by going to a neurologist. But there are a lot of people who deal with Lyme and co-infections and they get referred to a neurologist initially, and they usually aren't looking at, like Lyme is usually not on the radar of a neurologist, or at least most neurologists. And so a lot of times they get the runaround, and I just didn't want to go that route. So I brought it up to her. Just again, I'm not sure if that's what's going on, if it's like Lyme or Bartonella, but at least wanted to bring it up to her as a possibility, just with some of the unusual symptoms. And that's the thing with Lyme and these other tick-borne infections. A lot of times it's just they fall outside of the box. This definitely seems like the case here because she does have some mild TPO antibodies. But again, this could be completely related. She could have had Hashimoto's for years, taken a levothyroxine, and it seems like something changed. And we could say, well, maybe it was taking a levothyroxine, but she was taking levothyroxine for quite some time. So I think it is something else. I mentioned subacute thyroiditis also as a possibility where maybe she got exposed to a virus. With subacute thyroiditis, you become hyperthyroid temporarily, typically. It could be a few weeks, commonly a few months, and then you make the transition back to hypothyroidism. So that could have been it, where she was hyper and dealing with subacute thyroiditis. But again, why would she now still have tremors? Why would she have the resting heart rate still a little bit elevated when her thyroid hormone levels are looking good? I'm not sure. So I'm not sure if it was subacute thyroiditis. So definitely recommend more detective work. And I mentioned it's still a good idea to incorporate diet and lifestyle changes, not going to hurt, obviously, to clean up one's diet, manage stress, make sure you're getting sufficient sleep. But at the same time, probably needs to do, whether it's functional medicine testing or again, going to like I went to a Lyme literate functional medicine practitioner. And I also did some functional medicine tests at the time. Even if she goes to a Lyme practitioner, if it's one who practices functional medicine testing, they'll probably do some functional medicine tests. They're not going to just diagnose her with Lyme. Most of them, again, that's the medical approach where they'll diagnose her with Lyme, put them on antibiotics, even if it's chronic, a lot of times antibiotics for a few months, but that's definitely not the approach I took. I did take antibiotics for 2 weeks, doxycycline, because I thought, and the practitioner I work with thought it was acute Lyme and not chronic Lyme. But as soon as we found out it was chronic Lyme, I stopped the antibiotics and then started to do other things. Also worth mentioning that she saw a thyroid eye disease specialist because she's also experienced like the soreness in the eyes. And a TED specialist said there were pressure behind the eyes, but also said that she had dry eyes and mentioned maybe that it was related to aging, which I think, I mean, dry eyes, a lot of people have dry eyes. But if she's having pressure behind the eyes, that's kind of weird that he would say it's due to aging, because as we age, we don't necessarily have, I guess glaucoma is something that is more common as we get older, and I'm not an eye specialist, but maybe I'm wrong and maybe getting some pressure is normal, but something I haven't heard of. So again, I'm not going to say it's not, since I'm not an eye specialist, I guess I won't make that conclusion, but it just sounds like he was blowing her off. So like I said, I think Z definitely needs to dig deeper, possibly needs to work with someone. The question is who though, because again, it's not just like if it was Graves' disease or Hashimoto's or toxic multinodular goiter even, again, I'd be happy to work with her. But in this situation, I honestly don't think I'm the one to be working with her. I think maybe she needs to work with someone else in this situation because again, it's not, to me, her thyroid's looking good. Not perfect because the antibody is a little bit high. So again, not to say there aren't things I can't do to help her, but I don't think this is the reason why she's experiencing some of the symptoms. So that's my perspective on this. And just, again, wanted to present a case that's not straightforward because not all cases are straightforward. And sometimes there are Graves and Hashimoto's cases are more complex, but this is not one of those situations. This is something, I think, something else that's going on. Anyway, hope you found this conversation to be interesting and helpful. And of course, there'll be more future health audits coming in the future. And look forward to catching you in the next episode.